Auckland and Waikato are set to see an easing of COVID-19 restrictions, moving to Level 3, Step 2. Waikato's move will come first, with the region making the transition from tomorrow, before Aucklanders join in principle from Tuesday, November 9 at 11:59 p.m. Step 2 will mean retail and public facilities can reopen, and the number of people who can meet outside increases to 25. Prime Minister Jacinda Ardern said the decision to hold Auckland's move by a week was to give businesses time to prepare. Director General of Health Dr Ashley Bloomfield said his initial advice had been to hold Auckland at the same restrictions. However, after further discussions, Cabinet decided to set out the provisional move, taking into account the length of lockdown and Aucklanders' ability to comply.
These decisions are carefully balanced and allow us to release some of the pressure and fatigue that we know exists in Auckland, while we continue to vaccinate and prepare for the new framework where much more certainty will exist for everyone.
A new daily record of 162 COVID-19 cases was reported in the community today, 92 of which are not yet linked. Of the cases, 5 are in Waikato, 1 in Northland and the remainder in Auckland. There are currently 53 people in hospital, with 3 in ICU. There were no new cases in Christchurch, however, COVID was detected in wastewater samples on Friday. Meanwhile, in Auckland, another staff member of the Edmonton Meadows care home in Henderson has tested positive, bringing the total number of cases in the cluster to 10. 3 staff members on a COVID-19 ward at North Shore Hospital have also tested positive, and a precautionary review is underway while the source of the transmission was under investigation. Testing of other hospital staff did not reveal any further spread.
You can see from what we've just shared that while cases are growing, vaccinations have the ability to keep numbers down overall, and importantly also to keep our hospitalisations down, and in fact they already are. Overall, that means as vaccination rates go up, our risk assessment of cases can change. As you know, we want to be very careful about this shift in approach, and it is a shift. Previously, we worked very hard to eliminate every case. It was a simple strategy, and that one we could all and did all get behind. But while Delta has forced us to change our approach, vaccines mean we can still have very similar goals: to protect people and minimise the impact of COVID.
Ardern revealed that current modelling suggested there could be a peak of up to 200 community cases per day this month, but that was not unexpected, and rising vaccination levels across New Zealand meant hospitalisations were manageable. Just over 75% of the eligible population have now had 2 doses of the Pfizer vaccine, and just over 88% have received at least 1 dose. Of those infected in the current outbreak, the proportion without a single dose has dropped from 82 to 72%, and the hospitalisation rate has dropped from 9.7 to 7.4% since September 9.